Okay, thank you, and welcome everyone to another episode of Beyond the Badge. I'm Steve Fecto from Talent Development and Learning, and as always, it is our pleasure to bring you another monthly set of stories of our employees at Mount Sinai Health System going beyond the badge. For our audience that is out there, many of you first time audience, family members of some of our celebrants, colleagues, we're here to cheer on for employees that you care about and love. Thank you for joining us. And we have many repeat guests. Our repeat guests that come month after month are our leadership. Mount Sinai Health System leadership comes every single month for the last 2.5 years or so to take in and be inspired by these employee stories. So I know you're going to really enjoy this episode. And thank you to all of our return viewers out there. For those of you who are new, let me set the stage. A little bit was in that opening video. But these stories were originally shared on our system daily huddle. Every single day, our most senior executive leadership come together from across our entire health system and have an operations huddle to ensure we're going to have a safe, high quality day here at Mount Sinai. But they've built in this pause where they say every single session, one leader is going to have their turn in a rotation to share an employee story. And they look for what's the most fantastic, powerful, emotional, incredible story that showcases our site, our hospital, our system so powerfully. And these are the celebrants that we have today. They're the ones whose stories were shared on that huddle proudly by our leadership last month in May. And thank you to our partners who lead that huddle, Joseph Mary, Swati Garg, Hillary Polly. They collect the stories. They send them over to our team, our Mount Sinai Spotlight Committee, so we can put on this show. It's going to be read. Each of these stories will be read by passionate members of the patient experience and the employee experience at all our locations around Mount Sinai. You're going to see them sharing these stories proudly, and of course, our celebrants that we can't wait to show and share their stories with you. To start things off, I always like to start off by calling on a couple of the leaders who I know are out there in our audience. There are so many more, and you'll see them in the chat. I hope you all participate with reaction buttons and get in the chat and write to everyone your thoughts and comments as we go. But I'd love to call on a couple to start us off. One leader who I know is here with us today is David Feinberg. He's the Senior Vice President and Chief Marketing and Communications Officer for the health system and the Dean of Marketing and Communications for the Icahn School of Medicine. David, I know you love a great story, and we're filled with them today, so I'd love to give you a chance to welcome our audience.
Well, Steve, thanks so much for the opportunity to speak on behalf of the leadership of Mount Sinai to help celebrate the wonderful caregivers being honored for their exceptional commitment to the best in patient care. Each and every story we hear today is an inspiration. And also, I know many are accompanied by their families and loved ones. They too should be very proud of the vital role they play in helping support this important work. No one does this alone, so thank you as well. You know, one way to think about what we do in marketing and communications is that we tell stories of how you help patients, families, and communities improve their health and well-being. These stories give people hope and information. Hope that with our expertise and compassion, we can help them overcome some of life's most difficult challenges, and information on how to get and stay healthier. You know, it may surprise you to learn that last year we had over 90 million visits to our website. That's a lot of visits, but why? They visit our website to learn about the extraordinary care you provide, to pick the program or caregiver that best meets their needs, to be inspired by the extraordinary advancements being made right here at Mount Sinai, to get accurate and reliable information about healthcare. So ultimately, they can choose the best possible care as exemplified by today's honorees. As we learn about the caregivers being acknowledged today, we also celebrate each and every one of you. Every person listening to me today made a noble choice to devote your considerable skills, talents, and energies to helping others in their moments of greatest need. This is no easy task, but you make it look easy. So no matter what your role, you are part of a caregiving team. It's an honor to work alongside you, to have the privilege of telling your stories, stories which inspire so many. You show us all how we find a way each and every day. So I'll turn it back to you, Steve, to hear about today's inspirational honorees. Thanks again for inviting me to be a small part of it.
Thank you, David. Really wonderful. And I want to agree with you. To everyone who's watching here in support of a colleague, you're absolutely right. It is a team that led to these celebrants being up here. There's so many are from patient letters, and we know their entire experience must have been great to want to write a letter, even though they may have highlighted an individual in that group. So thank you to all who are here supporting and cheering on for your colleagues today. Another leader I'd like to call on, again, we have people from around our whole health system representing Mount Sinai, Morningside, and West. I know Marcia Sinanan Vasishta is here. She's our Vice President of Patient Care Services and the Chief Nursing Officer at Morningside and West. And thanks for joining us today, Marcia.
Thank you, David. And I'm so thrilled to greet all of you fabulous ones. And you are fabulous because you have gone above and beyond the badge. And what does that mean? That means that you have done something or you continue to go above and beyond the minimum standards of, well, just wearing the badge. You have role modeled our Mount Sinai Health System values, and you have made a difference in the lives of our colleagues and of our patients. And we love celebrating you. We know how meaningful recognition keeps us all connected and gives us fuel for the fight and the work. So with that said, I just want to thank you all. I want you to continue to be that bright spot in your department. And it's my pleasure to greet you all and to be here today. And I'll hand it back to you, Steve. Thank you.
All right. Thank you so much, Marcia. And I love what you said. Everyone meets the minimum standards of excellence at Mount Sinai, which is a really high bar. And that's what we say. Everyone brings our values to life, that we find a way spirit to life. So to be celebrated as beyond the badge is really, truly exceptional. To have some story that out of 43,000 employees, to have your story shared by a leader on this huddle last month is truly remarkable. So thank you all for going beyond the badge. And Marcia, I know you're going to love these stories, not just the ones from Morningside and West, but all of them you'll be truly inspired by. So let's get right to it. In the resources, this is new to Zoom, just a couple of months. We've been using this resources tab. Check it out. There's links to star recognition where you can celebrate a colleague. There's links to our program that you can follow along today. You can download it in the documents folder, or even go, I love it, the speakers option under resources, and you can see some photos and some quotes and the order we're going to go in today. Now, I might bounce around because it's a busy hospital and some people are with patients and they're going to get here when they can. So if I bounce around in the order, I'll alert everyone to that. But follow along, and thank you to those of you already active in the chat. Please use that. Let your voice be shared and heard by our celebrants as you cheer them on while we speak to them on stage. Okay, with that, let's jump into our first story. We have our team that we're going to start with. It's a trio of leaders from pediatrics. Please let me call up from Mount Sinai Hospital, Ashley Jamison, Wendy Para, and Lisa Keynes. And I'm going to have our colleague God's Favor Guillet read this story. So God's Favor, if you want to start it off as we bring up our trio.
Excellent. Congratulations, everyone. I'll read the story. The outstanding leadership team in pediatrics, including Ashley Jamison, Wendy Para, and Lisa Keynes, exemplifies resilience, teamwork, and a shared commitment to excellence. Most recently, their dedication was evident as they ensured every aspect of preparation for the Epic Go Live, and the Joint Commission survey was meticulously handled. Wendy's hands-on approach extended to ensuring clean and presentable exam rooms, while Ashley took on the role of an overnight instrument inspector, meticulously ensuring the integrity of sterile instruments. Lisa's collaborative spirit shone brightly as she worked tirelessly with the team, ensuring all areas were in impeccable shape. And with her ever-present smile, she consistently checked in with staff, fostering a supportive work environment. This team's dedication paid off with 0 citations, a testament to their unwavering commitment to excellence in pediatric care. Together, this team always finds a way as they navigate obstacles and achieve collective success.
All right. Well, thank you so much, God's Favor. I'm going to go to this team here. I know we have 2 of the 3 of you here today, but can someone speak to how it took all 3 of you working collaboratively to see this team through a smooth Epic Go Live and Joint Commission visit? What is it about this team that makes you so effective together?
Good afternoon, everyone. So for the PEDS team, I can truly say we lean on each other's strengths. We work together as a team to make sure that our departments run as smoothly as possible. If it wasn't for Lisa's expertise in Joint Commission, uh, we wouldn't have been able to do it. And we just thank her because she led us and we did what we needed to do. And then for the Epic Go Live, Wendy and myself, we relied on each other. We made sure that the things that we learned in our trainings were always communicated correctly to our teams. So it's a matter of teamwork, and that's what we need in a PEDS team, especially is teamwork. And anywhere in Mount Sinai, it's great to be on a team that is communicative, that communicates effectively, and that works together really well.
Yes. It's truly a pleasure to be a part of this amazing team. We definitely pulled together and we made it happen. We actually made things work. I would have to say that we also have a great supportive leadership team as well. So they stand behind us and everything that we do. So we would like to acknowledge them as well. Wendy was not here today, and I would just like to say Wendy always said that we will find a way. So that's how she keeps us going as well. Thank
David
you.
and I love to hear that. I know, absolutely. And you did, and you found a way in these two examples. And, these special moments and these high leverage moments, that's when that teamwork really shines. And it was obviously seen by your senior leadership, and they love to share this story to recognize you. So thank you so much.
Thank you.
Congrats on double successes last month.
Yeah.
One other story I'm going to alert everyone to in the program, some of the people who couldn't make it here, you can find their stories in writing in the program. So there's one for the New York Eye and Ear Periop team. They're in a busy OR. They're not able to step aside as a team to join us, but please take a moment to read their story. It was written by a patient whose surgery was completely stress-free experience, they said. And the whole team's commitment to the patient experience is top-notch, to quote that patient. So you can read that full story right there. I'm going to move on to a category of more appreciation by patients. We've got 5 stories to share where patient letters led to the recognition. Another one is in the program. You'll find it. It's a We Find a Way story about Dr. Jonathan Murphy of Mount Sinai, Queens, who, after struggling with symptoms that led to more than 20 emergency department visits in Florida with no diagnosis, it was during a trip to New York and an emergency visit to Mount Sinai, Queens that led to Dr. Jonathan Murphy diagnosing the issue and, as the patient put it, changing their life. You can read that story in the program along with Dr. Murphy's response, where I love this. He says, "Most importantly, I'm grateful to be able to work with the incredible patients in Astoria, which is reward and valuable, more valuable than anything else." So that's wonderful. But now to the folks who are here, I know eager to go is Mount Sinai West Ambulatory's story for Lauren Toglia. So let's bring Lauren up with our West presenter, Andres Morera.
Hello.
Hey, welcome.
Hello.
I'll
Thank
turn
you
it
so
to
much,
Andres.
Steve. So, although lead ultrasound technologist Lauren only joined our 787 radiology practice this past March, patients are already writing to express their praise. One patient writes, quote, "The staff is always very good, but Lauren was especially warm and helpful. She went above and beyond to make sure that I was comfortable. I immediately took down her name to make sure that when I got this survey, I could mention her. She is the absolute best." Another patient says, "I met Lauren for a sonogram and she was so kind and caring and professional. She helped me forget the test was going on and relieved all of my stress during the sonogram. You are so lucky to have this staff member." Lauren has truly been able to make a meaningful impact on our patients and staff members in her short time here. We are so grateful to have Lauren on our Mount Sinai West ambulatory team. Congratulations, Lauren.
Thank you.
Oh,
I
thank
don't
you,
know why I get
Andres.
emotional. I've already read this. I don't know why I'm emotional
I
here.
can't hand you my tissues, but I'm ready with them in case you get me. Lauren, I just love this story because our team also does new beginnings orientation for our new hires. And how inspiring it is to see that you just started on March 25th at Mount Sinai. And by mid-May, they're being celebrating your story on the system daily huddle in front of executive leadership. So I'd love to hear, when you came in, what is, your approach to see your new role that led you to such quick and great success? How did you approach this new role in this new team?
Well, so a little bit like a quick backstory. So both of my parents are teachers.
Mm-hmm.
So growing up, watching them be role models and, having to teach, children of different levels and, different understanding, I learned pretty quickly that not everybody absorbs new information at the same pace, and might need a little bit of a different way to understand things. And it takes a lot of patience and compassion. So I just try to, when I meet somebody new, whether it's a patient, whether it's a colleague, I don't have a cookie cutter approach to things. I kind of approach people based on individual needs and what they, how they need to understand and learn. So basically it boils down to my parents and their great example. And also I had a lot of wonderful mentors when I was a new student, a new hire. And I take a lot of what they've taught me and try to apply it every day at work and in life.
Well, it's making an immediate impact, that approach, for sure. And I love to see that the patients are already writing about you. And you're definitely showcasing our values when you say that cookie cutter. There isn't a cookie cutter. It takes creativity, it takes empathy, understanding each patient as an individual to be able to provide that exceptional experience for each of them. So I love that picture of not being a cookie cutter. So thank you so much, Lauren. Keep it up.
Thank
We're going to have you
you.
back again, I'm sure.
Thank you so much.
Okay, thank you. Andres, you stick with me. We got another one this time. This time from Mount Sinai West, the hospital leadership recognized a pair. And this was the month of pairs. There were two people to several stories in a row here. I don't think Rosita was able to make it, but we have Kira Downs Vogel, who was celebrated with Rosita Atienza by a patient letter. And Andres, I'll let you take this story.
Thank you so much, Steve. And yes, I just heard from the nurse manager that Rosita is caring for a patient, but just a testament to what everyone's going to hear today of the wonderful work that she and Kira provided. So a patient reached out to share two positive experiences with nurses during their recent labor and delivery and postpartum stays here at Mount Sinai West. Quote, the first was with a nurse named Kira, who was exceptionally kind and caring during those first few vulnerable moments after birth. Her care and kindness in helping me get to and from the bathroom and settled in after the birth really stood out to me. And I am so thankful for how she treated me like an individual, addressing my needs with the utmost care as I started my adjustment to my new postpartum body. The second nurse, Rosita, I saw during my first and second days in postpartum. She was warm, welcoming, and was so affirming with the care of our baby. Her respect for her patients and her ability to provide supportive, compassionate care that sees the patient as a whole did not go unnoticed. The support from both of these nurses made my experience during those times under their care truly supportive and memorable.
Yeah, thank you, Andres. And what I love about this is, Kira said her and Rosita don't really work together. They're in different departments. They're a different part of that full experience that a patient will go through. But the patient both hit on care and kindness, but also on how each of you made her feel seen and treated as an individual. To have that experience from two different people on two different teams was spectacular. And Kira, I wonder if you can speak to, how do you provide that level of personalized attention to each of your patients?
I just want to say I really loved being honored with Rosita, and I'm so sorry she can't be here because she really upholds the partnership that labor and delivery and postpartum have, which I don't know that there's any other two units that have that connection. And for me, that space is created through the larger organization, especially through teamwork and community and our really wonderful leadership and really safe staffing. Over the past year, our unit has really come together and leadership has seen us and they've really improved our staffing. But people who know me in this organization are gonna be ready to squeeze me, but I cannot pass this opportunity when I have this leadership attention to remind you that we would love our grid to reflect the amazing staffing that you've given us to really show your commitment to our excellence. So thank you everybody for this honor, and thank you for the staffing and just a wee bit on our grid to put that permanent. Thank you.
Thank you so much, Kira. Wonderful story, wonderful patient feedback. I'm sure it's not the first time you've heard from patients expressing how much they appreciate your care in this important and memorable moment in their life. So thank you so much, and congrats to you and to Rosita. I know Andres will pass along that congrats to Rosita as well. All right, we have two more in this category, or three more in this category, actually. Two in a row at the network practices. First for network practices, and then the network practice patient support center. So Zoe Long, come on up for the next two. We have Donna Noth is with Christina Rudin. They were recognized as a pair. There they are. Okay, excellent. And Zoe, let's hear their story.
Yeah. So for Donna Noth and Christina Rubin, they were part of a care team for a surgical patient of Dr. Takahashi. Upon this patient's return visit, he wanted to be sure the manager knew that he was so impressed with the level of care he received from the physician, nurse, and medical assistant throughout his entire process. He emphasized that he had never had a more professional, caring, empathetic, organized experience in any medical facility. Thank you, Donna and Christina, for your continued excellence and commitment to the Mount Sinai standards of care. You are both appreciated for all that you do.
Thank you, Zoe. Very nice. And Donna and Christina, so this patient comments that they've never had a more professional, caring, empathetic, or organized experience in their life, in healthcare or beyond. So what stands out to you from that comment? What is the connection to the commitment that you make to caring for patients that leads to such exceptional experiences like this?
I think her and I are very common. We're a team and we really care about people. Sometimes, I think we tend to get really involved with them.
We're interested. We're interested in what they're going through. Patients come in, they're either consulting for surgery or they're having procedures, so they have a little bit of anxiety going on. So we try to quiet their fears, answer their questions. And of course, Dr. Takahashi is wonderful. So we have no problem, expressing that to the patient that he's in great hands. And, we do everything for him as best we can. So he doesn't have to worry. He just goes in and has his procedure. And,
as a team, we have everything, I feel, organized from before they come in to when they leave. And we try to communicate with them in between before their next follow-up. If they need to call us to follow up with anything or get a hold of the doctor at any time to make it easier for them. So they don't have to feel like.
Yes, Donna's great with the post-op instructions. She gives them details and gives them her number in case they need anything. So they never leave here with any questions of being able to contact if there's a problem. So
and that hits on the professional and the organized, that they never had something so organized, and think of how much trust and confidence that gives you when you're going into surgery like that. And then I love the word you used, Christina, interested. We're interested. I mean, that is empathy coming through. We show this interest in the person and understanding them, and that interest for every patient, it makes that emotional connection and difference. So wonderful story, wonderful recognition. Congrats on being such a great team. I hope you two stay together. Continue to provide that level of excellence. Congrats.
Thanks.
All right, Zoe, we're going to keep you right here for the next story. Terry Ann Wilson and Adrian Cantave from the Network Patient Support Center were recognized by a patient.
Yeah, so we have another group here. So a patient called to express appreciation for Terry Ann and Adrian on our Manhasset lines. The patient shared that she recently had to make some very important medical decisions, and the process had been causing her a great amount of stress and anxiety. But she wanted to share how lucky she felt to speak with Terry Ann, who was kind and helpful, and with Adrian, who helped put her at ease. She praised them for being really caring and applauded their excellent communication skills, which we're very happy to hear considering they work for our call center. Overall, the patient was very appreciative of their empathetic demeanor and their continued commitment to really caring and helping to turn her experience around. We appreciate their patience, kindness, active listening, and the hard work they do on a daily basis. We are so happy to be able to recognize and celebrate them today.
All right, well, thank you. I know we don't have you on camera, and I know Adrian is there also on camera. If you can come off mute, we'd love to be able to hear your voices. At least we have a few that don't have camera access for their presentation today. But Terry Ann and Adrian, so this patient repeated the words kindness and helpful in multiple spots in this message. Are these communication goals you have for all your patients? Is this what is part of the heart of the care you give and the commitment you make, particularly for patients who may be stressed and anxious about the healthcare process, like we heard in this example?
Yes, we definitely try to be caring and understanding of all of our patients. We try to look for key phrases that they say to us to know how to gauge each conversation and how to move forward with each patient. So yes, definitely.
I love that impact of picturing you with these key phrases that you recognize. It's that both being in the moment and listening to understand while also having experience and knowledge and insight into what are those key things to hear where I know what the next step might be to make a difference for this patient. That's that balance of that empathy and that experience coming together, Terry Ann, really wonderfully put.
Yes, I would definitely piggyback off of what Tarian says. It is a pleasure to like assist people and help them as much as we can. We are in that type of field and business to, assist patients, help them as best as we can, and make sure that they leave happy and they are heard. So it's a
Absolutely.
great feeling.
Yeah.
Definitely.
Really wonderful. And, I shouldn't be surprised that both your voices, even though we only hear you by voice, it's like we're getting the patient experience. We only hear your voice and we can hear the emotion, and we don't need to see you to feel the care that you're putting into your work with this perfect pacing and diction and everything that makes you such professionals at your work.
Yeah, definitely.
Really wonderful. Thank you, Adrian. Thank you, Terry Ann.
Thank you.
Appreciate you and congrats. Okay,
Thank you again.
Thank you. One more story in our appreciation by patient section. It's for Tulsa Davis and Jennifer Gaspard from Mount Sinai downtown. I'll have one of our downtown committee members, Dominique Stennett, take this story.
Hi, everyone. We're recognizing two of our team members from our 788th Avenue practice. Medical Assistant Tulsa Davis and Lead Medical Assistant Jennifer Gaspard demonstrated compassion and teamwork during a difficult phlebotomy draw for a geriatric patient. The patient's daughter expressed her concerns for her mother as she has previously had multiple unpleasant experiences with unsuccessful venipunctures. Demonstrating their years of clinical skill and excellence in patient care, Tulsa and Jennifer were able to successfully and safely draw the patient's blood on the first try. The daughter was ecstatic and so thankful that her mother did not have to go to the lab. This is one example of many that demonstrates how fortunate and grateful we are to have Tulsa and Jennifer on our team.
Thank you, Dominique. And Tulsa and Jennifer, aside from the shout outs you're getting from Kelly in the chat, who's very excited for you. I'd love to, aside from your clinical skill to perform this difficult phlebotomy draw on the first attempt, excellent skill. It highlighted, I'd love to hear about this approach you have to the patient emotionally. You heard through their experience that they have anxiety and concern from their previous experiences. How did you take that into how you approach this patient?
Well, the way we approached the situation was I already felt what the patient felt over the phone and what she expressed. And I said, you know what, we're going to give it a try. So I knew Tulsa is very good at getting small veins. So I came up with the approach of, hey, let's do this as a team. I held the skin back for Tulsa, and you can tell what she did.
So yes, it was honestly a teamwork. Yes, it was really a teamwork, and we really show empathy to the patient. She, as the daughter expressed, it was always a difficult time with anyone trying to get the blood work. So we went in as a team. I always put myself in the patient's position where if I'm in the seat, I would want, the best job done. So we worked as a team and we got the job done, and it was really good, right?
Yeah. Well, I love it. And I love the insight into the story that it happened before happening live, that you heard this on the phone and recognized, I got to do something special. We need to go beyond what would be the normal process and come up with a plan for this person because I can feel the anxiety. And Jennifer, great initiative to do that and call on the pro at the small veins. Tulsa, now we all know, first shot every time. So really wonderful teamwork, as you put it. And thank you so much. Great story. And I'm glad the patient took the time to write that appreciation.
Thank you.
Okay, thank you. Have a great day. And hang in there. We're going into our next category, everyone. This is the Stories of Excellence category. We have a few stories that are these one-time events, these one-time miraculous moments that we wanted to share, or just really special above and beyond kind of work that's being done that we wanted to share with you. There's someone who couldn't be here, Ramlin Bonilla, really wonderful story. You can see it in the program. A quick highlight is she's in our Mount Sinai Morningside Geriatric and Palliative Care Clinic. And she was talking with a patient who was so fascinated with a plant in the reception area that she was not familiar with and is a lover of plants that Ramlin took this proactive approach and presented her with her very own plant to take home on their next visit. A really remarkable above and beyond story. And she responded to that by saying, and you can find this in the program, I think that every human being has a purpose in life and mine is to serve others. Every interaction with a patient represents a new opportunity to continue serving this goal. Mount Sinai has given me the opportunity to accomplish my purpose every day, which is why I give only my best straight from my heart. What a powerful statement from Ronalyn. Again, so sorry we couldn't be here, but see her photo and her story in the program. But I'm going to go on to two more. I have Katrina Bravo from Mount Sinai, Brooklyn, ready to share a really wonderful story of the work being done by nurse Joseph Krivoruk. So let's bring on Joseph and Katrina.
Hello.
Okay, Katrina.
Congratulations to everyone who've been recognized thus far. I'm glad to present critical care nurse Joseph Krivoruk, who wanted to show family and friends of ICU patients more than words to support them and offer comfort during a time of patient loss. Drawing on similar programs he had read about in pediatric ICUs, he created the Message in a Bottle initiative, printing the patient's last active cardiac rhythm and placing it into a small bottle for the family to keep as a way of their loved one's heartbeat with them. To date, the ICU has shared these messages in a bottle with 10 families, and it has been received with appreciation and at times tears. We recognize Joseph for applying creativity and a caring spirit in bringing a new way of comforting our patients' loved ones and helping give his fellow nurses and ICU staff a deeper way of showing care. Thank you, Joseph.
Yeah, very nice, Katrina. And Joseph, can you tell us a little bit more about this program and how it's been received by the families and what inspired you to bring this to your patients and to the ICU?
Usually when we present these messages in a bottle, the families already, they either know what's going to happen or they either sign a DNR or whatnot, or it's a shock. But in either case, during the first few minutes, they're in the clouds. They are terrified of what's happening with them. It's really up to us to present with them with empathy, with compassion, and sympathy with everything's going to happen. Part of it is we present them this message, we show them what this is, explain to them. So here they are, they're walking to the hospital with their loved ones, they're leaving without nothing, but they really have something very, very personal to them. As far as what inspired me, had some couple of family things that happened over the last couple of years, and also about 14, 15 years ago, my grandma passed away, and the only thing I have of her is the last picture of her CAT scan. So nothing, not that I ever thought about this, but when I was browsing social media, I saw that another hospital is doing that. I thought it was a great idea. Showed it to my manager, Jackie Calendar, showed it to the director of ICU, Dr. SP, and they said it's a great idea, and just kind of everything just fell into the right place. So next thing you know, about a year later, here we are.
Yeah. And I'm sure it was 10 already. I'm sure there have been another one or two since, but
it's been a little more. I mean, we don't really count how many because it's reality is when we give this out, it's not for a happy occasion. So we don't count how many we give out. We give them out when it needs to be. Also, if there are multiple kids in a family or grandkids, we give it to them. This way they all have their own personalized mementos of their loved one.
Yeah, really wonderful. And as you spoke from your own experience, 14 years later, and you're, still have that moment. So you've provided this memory for people that they'll bring with them, for years to come. A really touching program. And thank you for being proactive and creative and, taking the initiative to bring that to Mount Sinai, Brooklyn.
Thank you.
Okay, thank you. Next story
my
from
manager says hello. Come here, boss. Come here, boss.
We got to move on to our next story, but give a quick hello and congrats to Joseph. There we go.
Good job, Joe.
Thank you.
Thank you. Thank you both. We're going to go on to our next story. It was for Mount Sinai Health System supply chain leadership recognized Astrid Lopez. We're going to bring Astrid up. Astrid works at Mount Sinai West, so I'll have Andres come back to read this wonderful story.
Thank you so much, Steve. So Astrid is a 22-year veteran at Mount Sinai and is currently the supply chain associate director for our operating rooms here at Mount Sinai West. She is extremely hands-on and works very closely with members of her staff, with the nurses, nursing management, and other senior leaders. But aside from what she does on-site, Astrid applies her expertise as a volunteer to help those that are truly unfortunate and unable to afford healthcare services. This past March, Astrid volunteered as a coordinator for the Mission Humanitaria Monte Cristi, located in Monte Cristi, Dominican Republic, where she organized, consulted, and also scheduled the cases for patients in need of medical attention. From pediatric to adult cases, all were seen regardless of their diagnosis. They completed 120 cases in just 4 days in very poor conditions. With no comforts, very little sleep, and all on her own time and expense, Astrid truly is deserving of this recognition. Congratulations, Astrid.
Yeah, thank you, Andres. Astrid, can you tell us a little bit more about this volunteer work that you do and what inspires you in this commitment to caring for others?
Well, I'm not very good at speeches, so I had to write it down a little bit here.
Okay.
I love helping people because it's what I was taught to do. The humanitarian missions that I attend have helped me further growth, both as an individual and as a professional. It's heartfelt when you see surgeons, nurses, and other staff come together for 1 week to provide care to people who have no other means. People who have been struggling with the health for years, and if not for this one chance, get no relief. I joined the mission to help in whatever I can to ensure the team provides care for as many patients as we can see. My role here is to ensure we provide excellent patient care, and I take my role seriously. It means ensuring that I take care of everyone. Thank you for the recognition and the opportunity to serve you.
Thank you, Astrid. Really wonderful work that you're doing as a volunteer. And it shows as an example of the 43,000 employees we have at Mount Sinai. Our efforts, the kind of people who work here, the kindness, the generosity extends beyond our walls. And you see so many stories like this, and you're a wonderful role model of that, taking that heart out into the world, as well as here at Mount Sinai. So thank you. Thank you for all you do for patients around the world.
Thank you.
Thank you. All right. And thank you, Andres. We're going to move into our next category, which is appreciation by colleagues. Many of these come from star recognitions. We have the link right in our resources tab there. If you want to send a star to a colleague, we're going to start with one at Mount Sinai Morningside. In fact, Tyler, I think we got 2 in a row at Morningside. The first one is for Tiffany Bourget. And I'm going to call up Tiffany. Hello. And take it away, Tyler.
Awesome. Thanks, Steve. Hi, Tiffany. Yes, excited to share this story. So a colleague wrote the following statement to recognize certified surgical technician Tiffany. There was a critically ill patient who required an above-the-knee amputation. The patient was nonverbal and in obvious distress. While the anesthesia team was performing the blocks that would allow the surgery to commence, the patient vomited copious amounts of blood. Tiffany stayed at the patient's head and not only effectively and efficiently suctioned the patient, but also consoled him and calmed him down. Her empathy and compassion allowed the anesthesia team to do their job in a way that would not have been possible without her, and the team was unanimous in their opinion afterward that the case would not have been able to have been done without Tiffany. Thank you, Tiffany, for all that you do.
Thank you, Tyler. Tiffany, I love the comment that the team was unanimous in this recognition for you. And I think they're even hiding in your virtual background behind you, listening in, cheering for you. There we go. I'm picturing that at the end of this case, they must have all come together and commented as a group on how you made the difference to this team and to this patient. And I'm wondering if you can tell us about how you view the excellent teamwork that you provide in your role with the surgical team.
Yeah, so as a new employee here at Mount Sinai Morningside, I always knew that I belong in the healthcare since I was a little girl. I always wanted to help people. It's something that comes to second nature to me. So I see that, during the procedure, it was so chaotic, but at the same time organized, like how everybody just efficiently made everything work. Like I couldn't do it without my team. I appreciate that. It was effortlessly what we did. And I was so it was like I was so happy that at the same time I was there to help the patient and he came out successful from the procedure, and it was natural to me. I knew that that's where I belong, and I just hope that I could continue growing with this wonderful family.
Well, you belong in the healthcare field, and we're happy you belong at Mount Sinai and that you're here with us and providing that level of exceptional care and teamwork with your team in that surgical area here at Mount Sinai Morningside. Thank you so much. Very wonderfully put and inspiring. Thank you. Congrats. Keep up that great teamwork at Morningside. Another one we have for Morningside, it came up twice in the rotation. It was another recognition from a colleague, is for Sahar Khan. So Tyler, let's hear this story for Sahar, who's not able to come on camera, I believe, but we're going to hear from Sahar.
Sure.
Yeah, so a colleague wrote the following statement to recognize lead PET and CT technologist Sahar. Sahar demonstrated exceptional dedication and compassion by voluntarily coming in on her day off on a Saturday to assist a patient in need. Despite it being her personal time, she went above and beyond to accommodate a patient who urgently required cardiovascular care. This patient, unable to go testing on a Friday due to fasting requirements, also had to fly out of state on Sunday. Without Sahar's selfless act, crucial information about this patient's health condition would have been delayed, potentially impacting their quality of life and timeliness of their care. Her commitment to patient well-being and her willingness to sacrifice her own time embody the spirit of excellence that made me want to honor her with this award. So congratulations, Sahar.
Yeah, thank you, Tyler. I know Sahar's watching, isn't able to come on screen, but is by phone. And Sahar, I gotta say, this remarkable selflessness in your commitment to caring for your patients. How is this an example or a reflection of the above and beyond care you commit to providing to every single one of your patients?
Honestly, such an honor to receive such a beautiful comment. For me, this is just a part of the job that I have signed up to do for, and each and every patient of mine is like a family member, and I would not want to make any patient go through anything less than what I would expect from my family members' care and so forth. So thank you for the award and mention. I really appreciate it.
Well, thank you, Sahar. And it's not just doing what you would want to do for a family member, above and beyond to come in and understand the circumstances this patient was in and making that selfless commitment to come in on a day off to ensure that they got a wonderful experience. That is beyond the badge. And we thank you for that. Congrats and thank you.
Thank you.
Okay, God's favor, Guille, I'm going to come back to you. Our next story is from Mount Sinai Hospital for Abby Patch. So let's call on Abby and God's favor for this next story.
Congratulations, Abby. Here is the story. A child life and creative arts therapy colleague submitted a star recognition for Abby Patch to recognize how she helped to see one of our pediatric intensive care unit families through an extraordinarily challenging experience. The family was coping with 2 of their children being simultaneously admitted to the PICU, one of whom had a scheduled spinal surgery and the other, an infant, who had a brain tumor resected. The parents faced significant coping challenges day to day, and Abby's warmth, creativity, and clinical acumen helped to humanize their experience and give them the support they needed to remain present and active as caregivers.
Yeah, thank you, God's favor. And I know all the parents like myself in the room are just trying to think of what this family must have been going through in this moment with both of their children in the PICU. Abby, while maintaining their confidentiality, of course, can you talk a little bit about how you approach this family and how you help support the parents through this deeply challenging time in their lives?
Sure. Yeah, this was a very unique situation in my almost 10 years of being here. I've never come across a family that has had 2 children in the ICU at the same time. But just providing them a space to provide emotional support for all the family members that were visiting the bedside. I provided a lot of sibling support for the older sibling that was at home that had both of their siblings here in the ICU, and just providing a space to provide play and opportunities for normalization for both patients that were admitted to the ICU. Yeah.
Well, it's incredible work. Another layer to the story of thinking of a third sibling and how they were handling this experience as well. To be able to meet the needs of children and parents is such a dual skill and talent and communication talent that you only see in that child life and creative arts therapy department. You're such experts at it. I think Todd, who I see in the chat, who submitted the star originally, so you never know where a star is going to go, and you write a great one. And I'm glad this one kind of rose to the top at Mount Sinai Hospital and was shared on the huddle. And we could hear this remarkable story. It's great work that you do, and everyone in your team does. So thank you so much for sharing. All right, thank you. And next up, we're going to go to Mount Sinai Hospital's faculty practice leadership, recognized Marianne Santos. We'll call Marianne on up, and Amy Nelson is going to read this story on behalf of the faculty practice.
Thank you, Steve.
The Department of Urology's Administrative Director wrote to recognize Marianne Santos's commitment to professional development. Marianne has been with the department through several roles, supporting the front desk, medical administrative assistant, and now as a surgical coordinator. Marianne always helps with any task and has recently taken on a new component to her role by learning the billing aspect. Marianne is a certified coder, growing professionally with the department and helping the department meet the patients and operational needs. Marianne does wonderful work, and we are very lucky to have her with the department.
Thank you. You know, Marianne, I love a good growth story where you keep learning and growing within a department and within the health system. Can you tell us what inspires you to continue to seek out opportunities for growth and development in your role and in your department and at Mount Sinai?
Yeah, so what inspires me the most is having great colleagues who believe in me. I truly believe that having a great support system will help grow my career, and that's what the department provides. I want to be able to use my experiences to make an impact on other staff members and patients. I do really believe it all comes down to the impact that I can make on patients, which gives me the drive to do and grow more. But I really do appreciate what Mount Sinai Urology has given me. So like the opportunities and support that Leonora, my supervisor, Allison, director, and all the doctors, Dr. Pruitt, Dr. Georgievic, and Dr. Blavis have given me.
All right. Well, thank you, Marianne. I love that you feel that support and that confidence in your ability to take on new challenges. I hope the new billing part is going well for you.
Thank you. Yes, it's going well.
And who knows what's next? You'll master billing before you know it. And you'll be on to the next aspect to continue to grow here at Mount Sinai. Thank you so much, Marianne. Congratulations.
Thank you.
Okay, and we're going to have one more category with 4 more stories in our employee spotlight category. These are stories where it might be highlighting a specific role or a specific project. As an example, there are 2 in our program. Couldn't be here. You'll find one for engineering plant manager Kenny Chunalal, who worked with the systems energy team in bringing about a major reduction to the Mount Sinai Queens campus's carbon footprint, reducing natural gas consumption in their boiler plant by more than 30%. So that is an example of a spotlight story that you'll see in the program. And another, the Clinical Command Center shared EMS Week recognition stories for EMT of the Year, Alvin Rodriguez, and Paramedic of the Year, Judith Bastine. You can read more about those stories for each of them in our program as well. But here we have 4 more individuals to share their stories with you. We're going to go first to Mount Sinai South Nassau, where Security Officer Andy Georges was recognized, and I'll have Olivia McGregor share that story.
Hi, Steve. Thank you very much. Today, we're recognizing Andy Georges, who is one of our security officers on D4, which is our inpatient behavioral health unit at Mount Sinai South Nassau. Andy prides himself in particular on the connection he is able to make with the vulnerable patient population on the unit. Andy does so by listening to his patients and supporting them. It is very likely that you will find Andy going above and beyond to engage the patients by playing games or even facilitating karaoke to help them pass the time. It is no surprise that Andy is well respected by patients, families, and the staff of D4, who comment how Andy always has their backs. He consistently uses his CPI training for verbal de-escalation, keeping the unit safe with a calming presence. Andy always goes above and beyond the badge in every encounter and every connection he makes, and we are so fortunate to have him as part of this team.
And thank you. And I love when Beyond the Badge shows up in the story, naturally written in there. Andy, I also know when you got your invite, there was an outpouring of leadership cheering for you right in the email that we sent to you. They couldn't wait to celebrate you.
Thank you so much.
Yeah, this story really commented on your ability to make personal connections. So tell us about that. What's your approach and how are you able to make meaningful and caring connections with patients, with families, and with the staff on this unit?
Well, first and foremost, thank you so much for the nomination and being honored today. The connection comes from my background working with children with special needs for the last 16 and a half years. So when I first arrived and they told me about D4, I took it right away. And what I bring to it is we're all human and we all need someone to listen to and just be compassionate and sympathetic instead of being judgmental. So I try to connect with them on a personal level and just to show them that, you know, we're here and we support you and we appreciate you more than you know. So I try to make it like home, like, you know, tender love and care.
I love it, Andy. I love to also hear from your background that you brought in this experience with children with special needs and wanted to bring that into the healthcare environment, that expertise there. And I love the comment on coming in and approaching with empathy and not judgment. And I think that's such an important lesson for all of us to be curious, to be empathetic. It's a part of our equity work that we do at Mount Sinai is to not go to judgment, but to be empathetic. So thank you for role modeling that. And truly, obviously, your leadership is really impressed with the ability you have to make connections with patients and families and team members. Something to add?
Real quick,
Yeah.
real quick. The staff on D4, from the supervisor down to the nurses and PAs, are amazing. So to make the job even easier. So shout out to them.
There we go. Big shout out to everyone on D4 from Andy. I'm sure they're here cheering you on. So thank you for shouting them out as well. It does take a team for sure.
Thank
you for your part of it. All right. Thank you, Andy. And thank you, Olivia. Next up, we're going back to Tyler. We have another one from Mount Sinai Morningside. This time it was ambulatory leadership who shared a story for Yasneli Gonzalez. Hi.
Yes. So this past year, Yasneli Gonzalez has gone above and beyond to initiate improvements within our neurosurgery department. She recognized patients were uncomfortable with the furniture and seating in the waiting area, so she put together surveys and collected data to present to management, showcasing what changes she thought could be made. Her suggestions led to improved patient experiences. The department was able to substitute the furniture and make our patients more comfortable. She has been vital in providing cross coverage in the neuroscience department anytime there are staffing shortages, and recently allocated time from her busy schedule to help onboard and train the secretary for a new provider. She's a leader in the department and truly finds a way each time by always putting her patients, providers, and team first.
I also love it when we find a way comes into a story too. Yes, Nellie, thank you for having this proactive approach to look with the eye of the patient, to think of and empathize with the patient experience. And that's one thing, but then you got proactive about it and fought for change and advocated for change in this waiting area. So can you tell us a little bit more about your personal commitment to, in this example, and always putting the patient first?
Thank you, Tyler. Thank you, Steve. I'm so happy to be honored. Yes, so I usually work for like neurosurgery, so most of my patients are surgical, and I did see that they were complaining that when they were sitting down, their back was hurting, their legs were hurting. So I just put myself in their shoes and how I would like to be treated. So I found a way to make them more comfortable, and also thought, you have to just step aside any problems you may have and just make the patient feel good at all times.
Well, listening is one thing, understanding is even higher, and then acting on it is above and beyond. So thank you for being that active advocate for your patients, really understanding and empathizing with them, and then getting right in there and making the change that's going to improve their experience.
Thank you.
Sure, it happens here in this story and all the time and every day in your interactions with them.
Thank you.
Appreciate it. Congrats. And thank you, Tyler. We have 2 to go. We're going to go to Mount Sinai Beth Israel next. We have Nurse Natalie Morrison. We're going to call up, and Christine Pescator is going to share this story for Natalie.
Hi, good morning, Steve, and congratulations to all our celebrants today. Natalie Morrison has been a registered nurse in the Mount Sinai Beth Israel Emergency Department for a little less than a year. In this short time, the many accolades she has received from patients for her bedside manner are hands-on care speaks volumes. Her compassion has also been duly noted by coworkers. She is efficient, calm, reassuring, and informative to the clinical staff as well as to her patients. We are extremely grateful to have Natalie on our team and thank her for taking such wonderful care of our patients.
Thank you, Christine. Natalie, I could have put this story in any of the categories. They're telling you the patients are talking, your colleagues are talking. We're going to lump it all into a big spotlight for you and the work you've done here since you've joined Mount Sinai Health System. As a new hire, just been here about a year, what is the commitment to your work with patients and the emergency department team that you came in wanting to demonstrate? And how has that helped you find success here at Mount Sinai?
Thank you, Stephen. Thank you, Christine, for sharing. It definitely can be challenging to enter a new work environment, but I've always been committed to teamwork. I'm very lucky that my colleagues have that same goal, and my managers help to foster that teamwork environment. I definitely grew as a nurse when I realized that part of healthcare is customer service. So up talking my coworkers and effectively communicating with patients cannot be overstated. All of this helps our patients to feel more comfortable in our care, which is a shared goal for all of us.
Yeah, absolutely. You know, we might think of the term customer service, but what is it really in healthcare is you're showing empathy to people. And you said managing up your colleagues, that teamwork, giving confidence that everyone here in the emergency department is going to provide you excellent care. And that's what our patients are looking for. So going in with that mindset, that's going to make you a great part of the team, as is proven in your first year here. So wonderful first impression and continued impression I'm sure you're going to make on patients and colleagues. Thank you, Natalie. Congrats. And our big finale, please welcome Argeli Nunez from Mount Sinai Health System's Pharmacy Leadership Recognized Argeli. She's from Mount Sinai Hospital, so God's favor, come on back and share our finale. God's favor, you got to do the opening and the closing.
I know. So exciting. Where's Argeli?
You can start up, might be off camera, so start up the story and we'll bring her on by voice.
Well, it is my pleasure to honor Argeli. Here's the story. Argeli Nunez, the lead pharmacy technician in our specialty pharmacy, has consistently demonstrated her skills and passion for assisting patients in accessing their medications. What sets Argeli apart is not only her proficiency in her role, but also her compassionate approach toward patients, especially those who speak Spanish. Her presence at the pharmacy window brings comfort and reassurance to Spanish-speaking patients, fostering a trusting and supportive environment. Argeli's leadership qualities also shine through in her willingness to support and train new staff members, as evidenced by her invaluable contribution to the new Madison Avenue Pharmacy. Pharmacy leadership recognizes Argeli as a role model whose exceptional work ethic and dedication serve as a benchmark for others to aspire to, and her contributions are deeply appreciated.
All right, thank you, God's favor. And I know Argeli is here. If you're looking for a photo, go to the program and you can see a wonderful photo of Argeli so you can picture her face with the voice and Argeli's on the phone listening in. So Argeli, your leadership recognized that you have a passion for assisting patients in accessing their medications. Can you tell us about that? Can you describe the passion you feel for the care you provide to patients through your pharmacy role?
Hi. Thank you for the recognition. Well, I love helping people. And, you know, our team is very committed to help our patients. I have great mentors that help me out throughout the years, you know, with their example to provide, you know, the best service that there is, you know, at the pharmacy.
Well, thank you so much, Argeli, and love to hear about how you have learned from mentors here at Mount Sinai. And I think many, particularly with so many new hires being recognized on this episode, it feels like everyone having someone to look up to, some mentor, some part of support. I feel like that was a theme throughout today's episode. So thank you for highlighting that. And thank you for providing this exceptional both support for our patients, but also leadership impact you're having on the pharmacy and that new Madison Avenue Pharmacy as well. So excellent work. And thank you for joining us today and congrats.
Thank you.
Okay. Well, that is going to wrap up our show right on time. How do we do it? Right there at 1 o'clock as we're going to come into our big finale. This was our 29th episode. We keep coming every single month. There was a person recognized on today's System Daily Huddle. In June, we're going to take all of our June stories and come back with another episode on July 25th to share another wonderful set of stories. So if you enjoyed this and it was your first time, come on back. We're here every month at the same link. We look forward to seeing you then. But allow me, on behalf of our hundreds of folks that were in our audience today, to say thank you to this collection of honorees. Continue your great work beyond just what's happened over the last month and year, but into the future here for Mount Sinai Health System. You're wonderful role models for all of us here in Mount Sinai's Health System. Congrats. Thank you so much. Michael's going to put up a little promo for our ending, and we'll see you next time. Take care, everyone.